148/88 millimeters Grig despite dietary changes. According to CTC, what is the optimal blood pressure target for this patient? A. 140/90 millimeters Hg, B. 135/85 millimeters Hg, C. 130/80 millimeters Hg, D. 120/70 millimeters Hg. Answer C. 130/80 millimeters Hg. Reference CTC 2018 p. 6 and 52. Explanation. For patients with diabetes, tighter control 130/80 millimeters Hg is recommended to reduce cardiovascular risk. Q2. A 72-year-old woman with hypertension and chronic kidney disease, eGFR 40 mL/min 7 mmol/L, is not at target despite an ACE inhibitor. Which agent should be added first according to CTC recommendations? A. Thiazide diuretic, B. Loop diuretic, C. Calcium channel blocker, D. Beta blocker. Answer C. Calcium channel blocker. Reference CTC 2018 p. 655. Explanation. In CKD, combination therapy with ACE inhibitor plus calcium channel blocker is superior to ACE plus diuretic for renal protection. Q3. A 45-year-old obese patient with uncontrolled hypertension is advised to reduce sodium intake. By how much can average systolic blood pressure be lowered if sodium is reduced by 800 milligrams per day? A. 3 mmHg, B. 6 mm, C. 8 mm, D. 12 mmHg. Answer B. 6 mmHg. Reference CT 2018 p. 655, Table 4. Explanation. Sodium reduction of 1,800 milligrams per day leads to an average fall of 5.8-2.5 mmHg in BP. Next, Q4. A patient is diagnosed with resistant hypertension after using 3 antihypertensive agents, including a diuretic. What is the next best step in evaluation? A. Add a beta blocker. B. Rule out secondary causes like hyperaldosteronism. C. Switch to loop diuretic. D. Increase diuretic dose. Answer B. Rule out secondary causes like hyperaldosteronism. Reference CTC 2018 p. 654. Explanation. Resistant hypertension requires evaluation for hyperaldosteronism, renal artery stenosis, or drug causes before intensifying therapy. Q5. Which lifestyle intervention provides the largest reduction in blood pressure according to CTC? A. Sodium reduction. B. DASH diet. C. Alcohol restriction. D. Weight loss. Answer B. DASH diet. Reference CTC 2018 p. 655, Table 4. Explanation. The DASH diet reduces systolic diastolic BP by 11.4-5.5 millimeters Hg more than other interventions. Q6. A 68-year-old man with hypertension and stable ischemic heart disease is started on antihypertensive therapy. Which class provides mortality benefit in this setting? A. Beta blockers, B. Alpha blockers, C. Thiazide diuretics, D. Direct vasodilators. Answer. A. Beta blockers. Reference CTC 2018 p. 656. Explanation. Beta blockers reduce mortality in patients with CAD and hypertension by reducing myocardial oxygen demand. Q7. Which of the following is not a common drug-induced cause of hypertension listed in CTC? A. SAIDs. B. Oral contraceptives. C. SSRIs. D. Statins. Reference CTC 2018 p. 653, Table 2. Explanation. NSAIDs, contraceptives, SSRIs, and corticosteroids raise BP, while statins do not. Q8. A 75-year-old hypertensive woman with prior stroke is being considered for intensive blood pressure lowering. What is the recommended target systolic BP for high cardiovascular risk patients? A. 140 millimeters Hg. B. 135 millimeters Hg. C. 130 millimeters Hg. D. 120 millimeters Hg. Answer D. 120 millimeters Hg. Reference CTC 2018 p. 655, Sprint trial. Explanation. In high-risk patients, both 75 years cardiovascular disease CKD, intensive SBP lowering to 120 millimeter Hg is recommended. Q9. A patient with hypertension and gout requires diuretic therapy. Which agent should be avoided? A. Loop diuretic. B. Potassium-sparing diuretic. C. Thiazide diuretic. D. Aldosterone antagonist. Answer C. Thiazide diuretic. Reference CTC 2018 p. 658. Explanation. Thiazides increase uric acid levels and can worsen gout, so they are avoided. Q10. A 60-year-old woman with metabolic syndrome has persistent hypertension despite non-pharmacologic measures. Which initial pharmacologic therapy is recommended? A. ACE inhibitor. B. Thiazide diuretic. C. Beta blocker. D. Direct vasodilator. Answer. A. ACE inhibitor. Reference CTC 2018 p. 657. Explanation. ACE inhibitors are first line in metabolic syndrome as they improve insulin sensitivity and protect against diabetes progression. These questions are designed